Malaria, please.
Like a sickness caused by mosquitoes.
Ah,
A sickness caused by mosquitoes.
okay, that's perfect. Mr. Duru, please tell us what you know about malaria. Mr. Duru, okay, first of all, I would like us to know that malaria is a parasite that is being caused by mosquitoes. But when we talk about mosquitoes causing malaria, malaria is mostly caused by female mosquitoes called Anopheles mosquitoes. These are mosquitoes. They are the one that causes malaria. And most time it is female mosquitoes too. Apart from being transferred from mother to child, someone can also get bit. It can also be from blood transfusion or from organ transplant. Someone can also get malaria from needle sharing. So at least these are about 5 different means that someone can get malaria, which 4 of them are from person to person, mother to child, blood transfusion from one person to another, organ transplant from one person to another, sharing of needles with another person can cause malaria. How malaria? Someone cannot get touching someone. Someone cannot get malaria by hugging someone, even though if it is an infection, but you cannot get it by touching or by hugging someone. Someone cannot get malaria from someone sneezing or coughing beside you. When someone that has malaria has a cold that make them to sneeze often or cough often, that doesn't mean that you can contact malaria from them. You can't get malaria from food or water, and from sexual contact. Someone cannot get malaria through those means, but can get malaria through blood transfusion. And we have different type of malaria. Only,
Ma?
do you know we have different types of malaria?
No?
Mr. Duru? Hello, Mr. Duru? Okay. I guess he's not here. He's just online in the class, but he's not with us. Okay, we have different type of malaria from different world. But the most common and the most dangerous type of malaria is in Africa. Like you can also get them in Asia countries or in some Latin America or in some Sahara African countries. But it is mostly common in Nigeria. Nigeria is one of those countries that mosquitoes are common. The most deadly type of malaria is Plasmodium falciparum. We have different types, but that number one is the most dangerous and most common in African country. Oyin, are you writing? Oyin, are you writing?
Yes, ma.
Okay. The most common and the most dangerous type of malaria is in Africa, and it is called Plasmodium falciparum. This type of malaria is the type of malaria that can make people to become unconscious or get into coma. This type of malaria can make people to faint frequently. Okay, stairs has joined us. We are talking about malaria. So the first one that I've mentioned is Plasmodium falciparum. Number two type of malaria that is also common, but it is mostly common in Asia and in Latin America, is Plasmodium vivax. VIVAS. Plasmodium vivax malaria is another type of common malaria, but it is common in Asia countries like India. Then number three type of malaria again, it is also mostly found in West African countries or Pacific Island countries. This number three type of malaria is Plasmodium ovale, OVALE. Then we have another type of malaria. It is less common. It is less common, but it can be seen. It can happen. It's called Plasmodium malariae, like malaria, like MALARIAE. Plasmodium malariae. The fifth type of malaria. This type of malaria spread from monkeys to human being. It is not from human to human. It is from monkeys, mostly from monkeys to human being. This type of malaria are common in places like Malaysia, Philippines, Thailand. It is called Plasmodium knowlesi, like know when you know something. KNOWLESI. Plasmodium. These are three types of malaria, and the most severe one is Plasmodium falciparum. That was the first one that I mentioned earlier. This type of malaria can even affect the brain. It can feel symptoms like stroke kind of symptoms. Then we will talk about how someone can get malaria from mosquito to human, the process. So when mosquito bit someone, when we talk about the process at which malaria occurs in the body, you don't just get malaria immediately you are being bitten by a mosquito. That is why in some cases you see people take medications like anti-malaria medications to help to prevent malaria, especially when you realize that you have been bitten by a mosquito and you want to prevent malaria. So these are the steps at which someone gets malaria transmitted from mosquito to human being. After being infected by a female mosquito called Anopheles mosquitoes, which are the ones that carry the parasite. Mostly they are pregnant mosquitoes. They inject saliva containing malaria parasite into the bloodstream. And when you have been injected of this parasite, this thing the parasite travels to the liver and it stays in the liver for some days, sometimes 7 to 14 days. So when you are being bitten by malaria, you might still be active without any malaria symptoms for the next 7 to 14 days. Depends on your body. Some people can start feeling the symptoms after 7 days, while some might even take 2 weeks. So this malaria parasite will be in the liver. So that is why in cases whereby people take medications like malaria parasite, anti-malaria medication, or even if you take herbs that works for malaria, or when you are on some medications that helps to cleanse the liver, it helps to detoxify the liver and remove this parasite. Then you realize that even as much as you are being bitten by mosquitoes, you don't have malaria. It's because of the type of medications that people take. Then when this parasite stays in the liver for 7 to 4 days, the parasite leaves the liver and invade the blood cell. This is step 3 of how people get malaria. Number 1 is being bitten by malaria. Number 2, the parasite travels to the liver. It stays there for 3 to 4 days. Number 7 to 14 days. Number 4, the parasite then travels to the bloodstream. From there, the parasite start destroying some of the red blood cells. It bursts into the bloodstream and starts destroying the blood cells. At this stage, people will now start feeling symptoms like headache, or start feeling symptoms like you are feeling feverish or pains. Yeah, that is why some people do complain that their first symptoms that shows that they have malaria is body pains, while some people will start feeling headache, because this malaria parasite is beginning to destroy the blood cells in the body system. Then when this thing start destroying the red blood cells, it's the parasite start multiplying in the body, and it keep bursting, it start multiplying. And this can happen within 48 to 72 hours, depend on the species of the malaria that the person have. Then it will not depend on the type of symptoms that the person will start experiencing. It can be fever, you can start feeling feverish, or sweating, or headache, or body pains, like I said earlier. When the malaria start busting, another new parasite will start developing, just like when you are planting something and it grows, then the seed of that plant drops on the floor, then it germinates again and start growing. That is how malaria parasite multiplies in the body system, and to start destroying the red blood cell. That is why you see that when somebody have malaria, their blood level, it is low. Most time it is always low. And even malaria medication, after taking it can still cause your blood cell to be low, your PVC to be low. That is why they advise that after taking malaria medications, people are advised to take blood tonic or something to boost the hemoglobin or the iron level. So that is it. Onye, hello.
Hello.
Okay. How many? Can you please summarize the steps at which people get malaria?
Treated by mosquitoes,
Mm-hmm.
parasite travel to the liver, and after that,
Okay.
they come to the bloodstream.
Okay.
Then they spread around the body and start multiplying in the body system.
Okay. So that is why after you are being bitten by mosquitoes, even if someone do malaria test, it might not show positive. It might be after 7 days or 10 days or 14 days when you start feeling these symptoms before you can test positive to malaria. Then you see people that has malaria. Some people will take their malaria medication the first day, they'll start feeling better. While some people will take their own for like 3 days before they start feeling better. Depends on the level of the malaria in their body system. Then, before you treat malaria, even if you know the symptoms that you experience when you have malaria, you are always advised to go for a malaria test first. Please, with that, you are always advised to go for a malaria test when you feel symptoms of malaria, or when you know that these are the signs that you feel that you experience when you have malaria. You are always advised to go for malaria test for you to know the species of malaria that you have. Because if you don't know the species of malaria that you have, it might be difficult for you to be able to treat that malaria properly. That is why you see some people who use some malaria medication, they will say it did not work for them. Probably they are doing self-medication. They didn't do tests. They just start taking malaria medication. You see some people that after 1 week, they will start feeling that malaria symptoms again. It is because they did not do tests for them to know the species of malaria that they have for proper test. For you to be able to treat malaria properly, you need to know the species of malaria that you have before you can treat it. Even under herbal medicine, we have different type of herbal medicine for different species of malaria. Just like we have orthodox medication for different species of malaria. The same thing with herbal medication. You know, when you tell doctor that, doctor, I have malaria, and orthodox doctor will still insist that you go and do malaria test before recommending malaria medication for you. It is not that they don't believe you or they don't understand. They might even know that yes, these are symptoms and signs of malaria, but they want you to go and do the malaria test to confirm the species of malaria that you have. Though we have a particular type of malaria that is common in African country, but we still have some that we still have in African country. So we might say it is A, but it might be B. But with a test result, we can be very sure if it is A or not. So you, as a practitioner or as a doctor, even if a patient tell you that they have malaria, always recommend them to go for a malaria test before you recommend malaria medication for them. Even if you know a very effective malaria herbs that work, you might give it to somebody and it might not work on that person, and you now be this medicine wey I don dey sell for over 2 years that has been helping a lot of people, why is it not working for this person? This person might have another species of malaria. You know, even when you kill mosquito or when you see mosquitoes, you will realize that why is this mosquito very black like this, or why is this mosquito like this? This mosquito is big or is different o. You know, we have different type of mosquitoes and different type of malaria. So for those that just join, the most severe type of malaria is in Africa and Asia, and the name is called Plasmodium falciparum, which are the most common type of malaria. When you go for malaria test, you will see that in the result, they will write P, then dot and falciparum. Sometimes they will write falciparum, they will put dot and put F. It depends on what that test result shows. In some tests, it might be P dot visas, that's falciparum visas. In some tests, even though if it is falciparum Plasmodium falciparum, some malaria tests will show you 1+, some will show you 2+, some will show you 3+. These plus signs are meant to show you or tell you how severe so this malaria test. So these malaria tests are meant to tell us how severe the malaria is in the body. The severity of this malaria will also let us know how long for the patient to take the medications, or what strength the patient is supposed to take. We have 100, we have milligram, we have 250 milligram, we have 1000 milligram of some malaria medications. Your doctor will tell you take it for 3 days, while some people will be told to take it for 7 days, and while some might be for 10 days. Depends on the brand, depends on the strength, and depends on how severe your malaria is. So I'm just using this to explain to us that even as a herbal practitioner or traditional medicine doctor, you need to know the type of malaria your patients have for you to be able to deal with the malaria completely. Mrs. Ifeyiwa. Mrs. Ifeyiwa. Mrs. Ifeyiwa.
Yes, I can
Okay,
hear you.
ma'am. How many type of malaria did I mention that you're able to document, ma'am?
You said in Africa we have that's 2 types in Africa.
Ma'am?
On and off. You said
Ma'am?
in Africa we have 2.
How many did I mention in total?
I did not start with you, Mama. I did not start.
I just mentioned them not quite long. You are not documenting. You are not jotting, ma'am.
No. I'm still in church. That's why I just entered the cab.
Okay. Oyin. How many types of malaria did I mention?
4.
4?
Yes.
We have mentioned them.
Plasmodium falciparum, Plasmodium Plasmodium malariae, and Plasmodium fluorescens.
The first type of malaria is Plasmodium falciparum, which is the most dangerous type of malaria. The second type of malaria is Plasmodium vivax. This type of malaria, their severity is not that much, it's moderate. Plasmodium ovale, these are not also severe type of malaria. They are also in Africa. Plasmodium malariae, they are mild chronic. This type of malaria, they are common everywhere. They are everywhere, but their symptoms or their invasivity in the body are not chronic. Plasmodium knowlesi, this one is also severe, but it is common in Asia country. But that doesn't mean that you cannot find them in Africa. But they are common in some certain places than the other. Even Plasmodium falciparum, they are common in Africa, but they are also common in Asia, but we can see them in some places. But this is the most severe type of malaria. Now I've mentioned 5 types of malarias that we have, and their severity. So this Plasmodium knowlesi, they are mostly from monkeys to human. One can contact them from monkey to human being. Maybe people that have monkeys, somebody can contact it from their monkey. Then from monkeys, from the person that contacted it from the monkey, the person can also transfer it to somebody else, maybe through blood transfusion, or maybe from mother to child, maybe through wetin dem dey call am, donation, maybe donated organs to somebody, and also from sharing of needle, or maybe from sharing of sharp objects. Someone can also get that type of get malaria from sharing of sharp objects. So these are 5 types of malarias, and these are ways that someone can get malaria. Then I also made mention that malaria is contacted from mosquitoes, mostly female mosquitoes, especially pregnant female mosquitoes. So those are the type of mosquitoes that can affect somebody with malaria. When someone is being bitten by mosquitoes, the parasite can stay in the body for like 7 to 14 days. It invades the liver, then from the liver, it transfers to the bloodstream. From the bloodstream, it will start bursting the red blood cell and start multiplying. These are the stages at which somebody have malaria. When it starts affecting the blood cells, that is when you start feeling symptoms of the malaria. Any questions so far before I will continue? Let me unmute everybody.
Good afternoon, Dr. Sugar.
Good afternoon, ma'am.
How are you?
I'm fine, and you too, ma'am?
I'm fine. We are missing you already.
I'm missing everybody too.
Thank you, and happy first Sunday of the month.
Yes, so same to you, ma'am.
I have a question about female mosquito.
Go ahead, ma'am.
You said that malaria is transferred through female mosquito.
Yes, they are called anopheles. Yes, anopheles.
Anopheles. That is the name of the mosquito.
Yes.
Okay. Then another question, you said that when it's being transferred to the body, there is a cervix you call. You say something like liver. I didn't get that part.
The malaria stays in the liver for days. So that is why when someone is taking something, a medication that cleanses the liver, maybe on a daily basis, maybe you are taking some type of medication that detoxifies the body, or like a cleanser or a bitters that helps to strengthen and to cleanse and rejuvenate the liver. You might be bitten by malaria, but that malaria will not invade your bloodstream. So you might not even have symptoms of malaria, even though you are being bitten by malaria, because it's just in the liver there. So when you take medication or you take anti-malaria medication, it will not allow the parasite, because it is a parasite. It will not allow the parasite to invade your blood cell. So when you do not take medication, the parasite will then invade your blood stream and start affecting the blood cells. It will start bursting them. Then the parasite will now start multiplying in the body. So when the blood cells start bursting, these are the stage that you will start experiencing maybe headache, body pain, feverish. That is why some people will be like their body is paining them. That is the symptom they feel when they know they have malaria. But it is important as a doctor that you should always advise your patient to do tests before you recommend any. But you need to know the species of malaria that beats them, or the species of mosquito that beats them, for you to know the type of malaria they have, for you to be able to recommend medication. Because different type of malaria have type of medications that work for them.
Okay.
So if you do not take the right type of, if you do not know the type of malaria, you might not know the right type of malaria medication to use.
Okay.
Do you understand now?
Yes. So from your answer, you are saying that the malaria will stay in the liver for some days, then the bloodstream.
Yes.
Okay. Is there any other place apart from bloodstream?
When malaria gets to the bloodstream, blood gets to every part of the body.
Okay.
You know, so that is why you see that some people will have malaria and they can pass out. People can
Mm,
have and enter coma. People can have malaria and end up having stroke. That blood can get to the brain. Yes, people can have malaria and have stroke because of malaria.
mm.
Yes, because it has gotten to the bloodstream, and it can affect any part of the body. People can have malaria and their liver will be damaged.
Hey,
You know,
Amare.
so malaria is very, very severe. I've seen someone that had malaria before, and the person ended up in coma.
Mm.
So malaria can cause all these things. Malaria can also cause brain issues in children.
Rain.
Yes, brain. Malaria can affect the brain. A pregnant woman that has malaria and did not treat it can affect that baby's health. Yes, ma'am. So that is why a pregnant woman must be very careful when they are pregnant. I don't know if you noticed that there was a time that they used to give free malaria medications to pregnant women at the hospital. They are very, very concerned about malaria in pregnant women because it can affect or determine the health of that baby.
Okay.
Yeah. So when we are talking about, man, you have a question?
I have what I want you to do for us. Eh?
Go ahead,
These
ma'am.
five names of the malaria types. We'd like to have it in the platform because we can't get this thing right, the spellings. Right.
Okay. I'll drop them in the group.
Thank you.
So when we are talking about the type of malarias, like I said earlier, when someone goes for test, your test result can show 1 plus or 2 plus or 3 plus. The number of plus that the test result shows determines how much the malaria is in the body. Then when we are talking about Plasmodium falciparum, which are the common type of malaria in Africa and Asia countries, the best type of medication for this type of malaria is, please, can you mute your, let me mute it by myself. So when we are talking about this type of malaria, the best type of medications for the malaria is artemisinin. That is ACT. Anything medications like artesunate, artemisinin, all those atem type of, or coartem, all those type of malaria medications are the ones that work mostly for Plasmodium falciparum, which is the common type of malaria in Africa. So you see that when you go to hospital and doctor give you artesunate or they give you coartem, then you should know that it is Plasmodium falciparum that the person have, or anything that has artemin, anything that has ate in it, it is Plasmodium falciparum, because these are the common type of mosquito malaria. Then we know that there are some people that they give them injections or medications like chloroquine. It is not common.
I'm going, she just calls me now. So I should not, let me say, from now to 5:30 I should be done.
Are not really common like Plasmodium falciparum, but they also exist. So when someone has Plasmodium visas, those are the times that they recommend medications like chloroquine for somebody. They don't use coartem, So chloroquine that works for this particular type of malaria. This type of malaria can be hidden inside liver for a long period of time. Can be hidden. and it is mostly reoccurring. If it is not properly treated, it used to reoccur very well, because some people will go and be using atemin or coartem for them. They will not know that what they need is chloroquine. So it's mostly reoccurring, though it is not really common in Africa, but it is present in Africa. Then Plasmodium ovale. This one is common in West Africa. This one too, chloroquine works for it. Chloroquine and primaquine. Anything that is queen. Primaquine, chloroquine, it works for that type of malaria very well. Then Plasmodium malariae. This one is worldwide. It is everywhere, but it is rare. It is not common. It can cause chronic infection in the body system. Chloroquine also works for this type of malaria. Chloroquine. Then we have another one that they call Plasmodium knowlesi. This one, artesunate work for it sometimes, but quinine, it is very, very effective, or combination of quinine or desoxylin works for this type of malaria. You see all this type of artesunate, chloroquine, quinine, all these components are also available in herbal medicine. But we need to know the type of malaria for us to know the type of medications to give to these people. They are also available in herbal medicine, and we will still get there. Hold on, please, I'm coming. So from everything that I've said so far now, please document this information. It is always important to confirm malaria with a blood test before taking medication. That is the first information this night. No matter what your patient tells you, always confirm with blood test the species of malaria that they have before you give your patient medication. Always avoid self-medication to avoid repeating malaria from reoccurring. If you do not complete your dosage, malaria can reoccur. So it is important that you complete your medication or avoid using self-medication, especially for those that do not do tests before taking malaria medication. It can cause resistance of that medication. It can make your body to become resistant to it, because malaria is also an infection. It is a parasite. When you take medication over and over because you are still feeling the symptoms, after 2 weeks the malaria comes in again, or you expose yourself to malaria and do not take care of yourself by avoiding being bitten by malaria. You are taking malaria medication reoccur, frequently. It can make your body to become resistant. And if you have this species type or a particular species of malaria, and your body now become resistant to the type of medications that work with it, that means there is problem. So protect yourself to avoid reoccurring malaria. So complete your food dosage. If you feel better after a few days, like 2 or 3 days, and your medication is supposed to be for 5 to 7 days, make sure you complete it, because we have a lot of people that do not complete their medication. They will feel like they now feel better. They will not complete their medication. So it is always important you complete your medication to prevent recurring malaria, or to prevent your body from becoming resistant to malaria medication of the particular species type of malaria that you have. For severe malaria, apart from oral medication, it is also advisable that people do steam baths. This steam bath can help those herbal medications to go into your body through the pores, which Oyibo people, orthodox medication, they use drip. Steam bath can help those medications to penetrate into your body better, just like drip. When someone is taking drip, you just realize that you start sweating. You start feeling sleepy, things like that. Depends on what they inject into the drip. So steaming can also help with these things. For severe malaria, combine oral medication and external medication, which is steaming. Any question, please?
Dr. Sugar.
Yes, ma'am.
Good afternoon.
Good evening. Good afternoon, ma'am.
Yes, ma'am. So, I have a question because
Go ahead.
a friend of mine told me there is a vaccination for malaria.
Me, I've not had that before.
So, actually, this is not just the first time I've heard of that. The first time I heard of it is from a friend that we work together. So she said whenever they are coming to Nigeria, they get vaccinated for malaria. So they
Are
don't
being
get
yellow fever you dey talk?
What do you say?
Are you talking about yellow fever?
No. So somebody told me last week again because I was sick. That last week I had a serious malaria. So somebody was telling me about the vaccination that it is not just common because it is very expensive. So it's not that common. So
Okay.
you said you've not heard of it. I actually wanted to ask you that how effective is it? And I was thinking maybe you have like an idea about it. So I want to know how effective it is and is it safe? Apart from that, is it something that children can take? All of those questions are the ones in my mind.
Well, maybe because me personally, I am not a vaccine kind of person. I don't discourage people from taking it, but I only advise. Even all those other vaccine or polio, all these things that they give to babies, I don't take them for my children. I am not a vaccine type of person. So I'm not really interested. It is something that someone is actually interested in. You might decide or choose to get to know more information about it. So me, I'm not a vaccine person. I don't take it, and I can't really give advice on taking vaccine. I don't take it, and I don't give it to my children.
Okay,
Even
what
at
about
yes.
so if you're saying that you don't take vaccination, what about the one for corona?
I didn't take it, and I never had one, and I'm healthier than those that had it. Yes.
Doctor, I will give you.
Yes,
Okay,
so
I'm not taking vaccine for that also as well. I did
no,
because
you must
I'm
take
so
it.
scared of the
You must take it.
vaccination.
I've seen somebody that took it, a doctor friend of mine that took it and that ran mad for a week.
Eh?
Yes, I'm not joking. I'm not joking. My direct boss took this vaccine then too. In fact, she sick past person wey get corona. In fact, she started having those symptoms after she took it. But a doctor friend of mine, my colleague, ran mad for a week. They tied him. They have to tie him. I'm not joking. I'm not joking at all. I saw it kuru with my kuru eye.
So this vaccination of it seems because the reason why I had the conversation with the person was because I was sick and I could not come out for 2 days, and that place is where I used to go buy food. So he was telling me that there are vaccinations and everything. And I now remember that was not the first time I heard of that thing. So I said, let me ask you. You see, I said, let me ask you if it's safe. And then because this malaria of a thing is just
Instead of you taking malaria vaccine, you can use anti-malaria cream.
Anti-malaria cream?
Yes, like malaria repellent cream.
Repellent.
Yes.
Okay.
You can use
it. Of that mosquito repellent cream, is it the same?
Yes. When you use it, malaria mosquito will not bite you.
Okay, but then how is malaria related to stress? Malaria and stress, are they connected?
Malaria can make you feel breakdown, as if you are stressed, like experiencing symptoms like body pain because your red blood cell has been broken down.
Okay.
So you might be feeling that symptoms like fatigue, headache, dizziness. You just feel like you are being overwhelmed, like you have been walking. So you just be feeling symptoms as if you have been going to farm for like 1 week. So you just feel broken down. So it's because your red blood cells are being broken down.
Okay.
So someone will start feeling like a sickle cell person. You know, the pains, the fatigue, just like people feel in severe malaria. That is just a little bit close to what sickle cell looks like. You know, sickle cell is a red blood cell issue too. So that is how it feels.
Okay. And also, Dr. Sugar, sorry, because I feel like I've been behind, and then today I just noticed that you were calling. Would there be classes on Sundays now?
Yes, because for now I'm not around. So
Okay.
it's because you've not been attending classes frequently. So that's why you are not aware. I'm not in the country at the moment. So that is why even the time are different, you know, and I just have to squeeze myself because we are even in the night here. We are in the night here. So I just have to make sure that the class take place. So for now, till December, the classes will be on Sundays. My own classes.
Okay.
Dr. Charles and Dr. Matthew still hold their own class in the school.
Okay, because I'll be coming for physical class from this week.
Yeah, that will be on Thursdays.
Thursdays?
Yeah.
No Tuesday class.
My own classes are on Tuesdays. I lecture on Tuesdays.
Tuesdays and Thursdays for November. We have restructured it. I'll be taking them on Tuesdays. Dr. Matthew will be taking them on Thursdays for only November.
Okay, Doctor Spirit.
So while I will be taking my own classes on Sundays for November.
Okay.
Yes.
Noted. All right. Thank you so much, Dr. Sugar.
All right, ma'am. So
Hello, Dr. Sugar. I have a question, please.
Okay, please hold on. I just wanted to say something based on what I don't know her name. I can't remember.
Toyin. My name is Toyin.
What Miss Toyin said about vaccine. You know, I just want to say my own view. You know, about vaccine. Like I said, I don't give my children anything vaccine or polio. There was one holiday period that my children traveled, you know, to my mom's place, and a child that already had measles, yes, measles vaccine, had measles and infected other children with measles. You know, so how come someone had measles even after taking measles vaccine and infected other children, because measles is very contagious, you know? Same with some other health issues that people already had, you know, some vaccine related to it, and they still have such health issue, because measles is one thing that almost every child have it in their lifetime, even after taking the vaccine. Then what is the purpose of taking a vaccine, a measles vaccine, and they still had measles? My own mama don't collect measles vaccine for me, but I can still remember vividly that time when I was age 10, I had measles. Same as other people, you know. So this malaria vaccine of 18, no go try am for Africa, no go try am, and I just dey talk my own. Go and take vaccine. Go to riverine area. Say na Ajegun abi na Ijo. Wetin be dis people? Wey dey for Bariga. Wetin be dis people? Ilaje. try go like they collect vaccine. Mrs. Toyin go use you do experiment. Go and collect this vaccine. Then I want to sponsor you. All bills on me. You go to like you stay there for 1 month. You now come back. Should we try it?
No. Maybe we not use
No. Maybe we use it to experiment at least to confirm this now.
No, don't use me for experiment. Hey, Dr. Sugar. Now
You don't
you
use
go
me.
now. Now you go take care. Not tell us.
No, now you go take am now. I will treat you for free in case if you end up having malaria.
If I end up, is it for the vaccination?
No, you take vaccine. I will now, take you to Ilaje. You stay in Ilaje for 1 month. Ilaje for Bariga. Maybe you go get malaria or not. Just for us to confirm the effectiveness of the vaccine.
Okay, actually, the first thing you mentioned that to take the vaccine is something you have to be doing like every year.
Okay.
It's not like a one-time, lifetime something.
Okay, you can still take it. Still take it and go to Ilaje. At least it should take up to a year before it will expire now.
See, Dr. Sugar, you know one thing, I don't like mosquito at all. So I know fit go Ilaje, maybe I can't go there, maybe mosquito can't dey bite people there.
Make we just confirm the effectiveness now. At least from
somebody else that like mosquito can go now. But I don't like mosquito.
Someone wanted to ask a question.
Dr. Sugar.
Ma'am?
Yes, ma'am. Like
Yes.
you about this malaria of 18, and the treatment.
Yes, ma'am. Yes, ma'am.
I don't know, as in, I don't know the complications in treating this malaria. Maybe if you say you have malaria, with what you're
Yes, ma'am.
saying, that with this malaria, some you can develop many crises in the body. But
Yes, ma'am.
if you want to treat it, they will say the person have typhoid and malaria. Because
It is not every time that someone have typhoid and malaria. It is not all the time. Someone can have typhoid and not have malaria. Someone can have malaria and not have it. Someone can as well have both at the same time. The reason why they always advise to have to go for the 2 tests is because most time a lot of people do have it. That typhoid, a lot of people do have it. And also for us to be sure that you don't have it. Do you understand? That is why they recommend doing typhoid test. It's just for us to be sure. If you have it, we treat it. If you don't have it, we look away. You understand? So it's just for confirmation purpose. You might not even have malaria, but you might be having symptoms that looks like malaria. Then with malaria tests, we will be able to be sure that you don't have it or you truly have it.
But you made mention that malaria can affect the brain.
Yes, malaria can affect the brain.
But maybe when we've not started this class, they will tell you it is typhoid that affects brain. If the typhoid is too high, it will affect the brain.
Malaria that affects brain. Typhoid mostly affects the gut.
Okay.
Yes, and typhoid can be so serious sometimes that even in scan, they will see traces of typhoid.
Okay.
Do you understand?
Okay. And in the
typhoid is also an infection.
Okay, ma. And in the treatment, you made mention of steaming. How can we do it, ma? Please.
We are still going to get to the herb aspects of it's in the column of malaria.
Okay, ma.
Yes, sir.
Okay, ma.
So, any other question, please? Hello. Any other question?
No, from my end, no.
Okay, so when we are talking about malaria medications, when someone is pregnant, The type of malaria medication that they mostly give to pregnant women is like a dosage of baby, because they consider the baby before they give medications for pregnant women. It is not all type of malaria medications that they give to pregnant women. Most time the one they mostly give to them is like Quatem, like baby malaria medication. So because of the baby, you must always consider the baby on whatever dosage you are giving a pregnant woman. Please, can we please mute our phone? So it's babies malaria medications that they give to pregnant women, and babies are at higher risk of having malaria because their immune system is not yet strong, and also babies cannot really express themselves. If they have symptoms of malaria, mothers will just be guessing what is wrong with this baby, unless you take the baby to the hospital before you can be sure of if they have malaria or not. So symptoms of babies in malaria in baby are also fever, baby shivering, baby refusing to be fed or to eat. Babies can also be vomiting, having diarrhea type of symptoms, diarrhea, vomiting. They become restless, they experience even convulsion. Like I said, malaria can affect the brain. Convulsion is from the brain. Baby can experience sleeplessness. They can look pale because of they become anemic because of malaria. Baby pulse too can become weak. Baby can start having difficult breathing. All these things can also be sign of malaria in baby. So we must always be observant of the symptoms that babies are experiencing. In fact, babies can run temperature, very high temperature, and you might even be assuming that or thinking that the baby is teething. Na teeth jare, na teeth. Meanwhile, it can be malaria. So that is why self-medication is not good. We must always be doing tests, even if we think or believe that it is malaria. Doing tests is very, very important. Please, I'm coming. So now I'm talking about people who should be conscious or avoid certain malaria medication. So like I said earlier, pregnant women must avoid some certain type of malaria medication. You must avoid it. Then people with low blood level, like people with severe anemia, they must avoid some certain type of malaria medication because of the level of their blood. Malaria on its own can make someone to become anemic. Even malaria medication can make blood level to still reduce because it works on the blood. It works on the blood. So people that has low blood level should avoid malaria medications like primaquine or tefanoquine. Those medications, they are too strong. They can cause severe red blood cell breakdown. So they should avoid it. They should avoid that type of malaria medication. In fact, if you know that you are anemic or you are SS, you should always try to avoid being bitten by mosquito. If it is to fumigate your room often, or avoid water around your environment, or to use net when you are sleeping. That's why you see that they used to advise pregnant women to use net when they are sleeping. So you can be using net when you are sleeping. So pregnant women should avoid ACT, malaria medications. They should also avoid Pemaquine. They should avoid desoxyline. They should avoid it. Safer options for pregnant women, they are clindamycin. Then all these baby malaria medications, Coartem, is good for pregnant women. ACT is good for them. ACT is different from Atemin. ACT are the one that they mostly recommend for babies. So that is what pregnant women should be using. Then children under 5 years or children that are underweight. Some children, they are 5 years but they are underweight. They should avoid Mefloquine, any malaria medications that has to do with queen. So when your baby is, you still have a baby till the age of 5, your toddler, make sure you are always protecting them from mosquito bites. Make sure you are always protecting them. So babies, neonates to toddler, you should be, they can only take malaria medication like all this ACT, like I said, the same thing with pregnant women. So people with liver or kidney problem, they must avoid mosquito. Kidney treatment, malaria medication can reduce kidney GFR. So these people should be taken care with extra care in an environment that there is mosquito. In an environment that there is mosquito, they should avoid malaria medication. I have had a kidney patient before that after a malaria treatment, the patient GFR dropped again, because of malaria treatment. Malaria treatment can affect kidney or liver patients, so they must avoid anything that has to do with malaria to prevent any further complications or issues, because it can impair the function of the kidney, because these medications can increase toxicity in kidney patients. So they should avoid anything that has to do with malaria. They should be taken care with extra caution. Then people with epilepsy or psychiatric health issues, psychiatric disorder, they should avoid any malaria medications that has to do with Mefloquine, because these medications can trigger seizure or anxiety or psychosis symptoms in people. That is why you see that when I don't know if anybody has experienced someone that used chloroquine that started itching their body and misbehaving. Please, let's contribute to this. Has anybody seen someone that used chloroquine or quinine that started misbehaving before? This is a question to the house, please.
Yes, ma, Dr. Sugar. I've
So
gotten the experience.
You personally, ba?
Yes, ma.
How was the experience, ma?
Someone cannot sleep. Oh. You'll be awake, scratching your body.
Yes, so someone with mental issue or seizure to avoid those medication. Any other person with such experience, or that have seen someone with such experience? Okay, so I think nobody else. So because these medications can trigger seizure or psychosis issues in the body system. So people with epilepsy or psychiatric health issues to avoid, because it can make their problem, can worsen their problem. They should avoid any medications that has to do with chloroquine, Mefloquine, especially Mefloquine, very, very severe. Then people with HIV/AIDS that are on all this antiviral medication, they should try to avoid malaria. They should avoid it. Anything that can make them to have malaria, they should avoid it, because at that period that they are taking malaria medication, because of the low immunity, they can have any type of symptoms. So they should avoid it. So people with heart condition too, should avoid prolonged type medication or some certain type of malaria medication because it can affect the heart rhythm, especially quinine or chloroquine. They should avoid it, and they must be monitored. They must be monitored, maybe with ECG or echo to be monitoring the rhythm of their heart. So before you give your patient malaria medication, you must always ask them questions about their health, even family history. Before you give somebody malaria medication, you must always ask them so that you know what to give them and what not to give them from asking them questions. It is very important. Some patients might not even know that a certain health issue that they have, they should avoid some certain type of malaria. So you must always ask questions. Any question, please? Hello.
Hello, Dr. Sugar.
Yes, ma'am.
Where my question is where you said that the people that is having heart issue
Yes.
should avoid prolonged treatment of malaria.
Yes.
That it triggers their heart rhythm.
Yes, ma'am.
You said that they should be monitored with what and what?
ECG or echo.
Okay, ECG.
Yes.
Or echo.
Yes. Monitor the rhythm of their heart.
Okay, what is ECG or echo?
It's tests that they use for heart issues to confirm if somebody have heart issues.
Okay.
Or to confirm how the heart rhythm is working.
Okay. Okay, that's my question. Thank you, ma'am.
Yes, ma'am. So those other ones I mentioned are the things to observe when taking malaria medications. Then these are some of the things that should be done when taking malaria medication. Please, also when taking malaria medications, I need to let us know that we should not use blood tonic when using malaria medication. It can affect the effectiveness of the treatment. And also don't take grape. Do we know grapefruit? That one that is like orange. Sometimes the inside can be yellow, sometimes it can be red. Hello. Hello.
Yes, ma'am, we know grape.
Grape can affect malaria medications from being working. In fact, it's not just malaria medication. When someone is on certain medications and you are taking grapefruit, it can block that medication from getting into the bloodstream and the medication will not work. So if you have an health issue that you are treating, that you are on medication, avoid taking grape. Just like when you are taking malaria medication, you avoid taking grape. Those people that like pito and adoyo very well, they put pineapple, they put grape inside. Grape e enter my eye. Please avoid it. The medication will not work as much as it's supposed to work. Then you might end up repeating the medications. Then from there, you might end up becoming resistant to malaria medication. So these are the things that one should do when taking malaria medication. You take all medication as prescribed. Complete. Hello. So Take all malaria medication as prescribed. If it is for 3 days, complete your dose. If it is for 5 days, 7, 10, or 14 days, make sure you complete your treatment. Incomplete treatment can lead to drug resistance. Then get plenty of rest. Make sure you rest very well. Your body needs energy to fight parasites and for you to be able to recover. You need plenty of rest. Then stay hydrated. Drink plenty of water or juice, but make sure you are well hydrated when you are taking malaria medication. When you are also steaming, make sure you take extra water because you are detoxing. Take a lot of water. Then try to eat light, but make sure it is a nutritious food when you are taking malaria medication. Eat nutritious food. It might not be main meal, but make sure that you are eating light, even though if it is pepper soup or something light, make sure that you are eating something nutritious. Avoid oily or heavy food during fever phase. That is why you see that when somebody is having fever, they will lose their appetite. They might not be able to eat some certain type of food. They just say, give me pap. That is what the body actually wants. The body wants you to eat light. If it is possible to even avoid some certain type of food, maybe you just do fasting or you do fruit fasting or liquid fasting, that is perfect. So don't force somebody that is sick or somebody that is having malaria to eat. Their body do not want it. That is why you see that at that time they will just be rejecting food. But as a caring African mother and African wife, we will say, daddy, I don't cook small vegetable for you now. Use this small pounded yam, take chop am so that you go fit use your medicine. Or you go say, because eat this spaghetti now or small indomie and egg, e go so that you go fit use your medicine. Please don't force them to eat food when they are sick. So make sure you are also monitoring the person's temperature. Monitor the fever symptoms. If they are getting better after 3 days, check if they are responding to the treatment. It is important that they are responding within 2-3 days. It is important. If this person is not responding, make sure you add 1 or 2 other things, plus minus, especially for those that did not do tests before they start. If the person did test and you are using the right medication for that parasite, the person will definitely get better in 3 days. Make sure you are also keeping your environment clean and free from mosquitoes. When you are treating malaria and mosquito is still biting the person, you should know that after that person completes that medication, in the next 7 to 10, 14 days, the person will have another malaria because the person has been bitten by mosquito and that parasite is stored in the liver. So don't think because you are taking medication, that parasite is just waiting for you. Finish the one you are taking. By the time you finish, the person, that one will burst and enter the blood cell. So avoid it. Make sure your environment is clean. Most importantly, ask your patients questions before you give them medications. So these are the things you need to do. The things you should not do during malaria treatment. Don't stop medications early. That because you are now feeling good, you should not stop the medication. Say, I'm okay now. I'm okay. The malaria symptoms might reoccur again after a few days. Don't do self-medication. As a practitioner, make sure you do tests or your patient do tests before they start medication. So don't combine alcohol with malaria medication. It is not advisable. Don't delay medical help when someone is having severe malaria symptoms. So like I said, someone can end up into coma when they have malaria. Someone can be having seizure when they're having malaria or convulsion during malaria. In fact, convulsion or seizure is another symptoms that a child has malaria. So don't avoid all those severe symptoms or medical help when these symptoms are severe. So that is it. So because your neighbor or your daughter also have malaria and you are on malaria medication, you now give them from your own. It will reduce the numbers of days you are supposed to use your own. And moreover, you don't know the type of species of malaria that they have. So let Mr. A use his own medicine while Mrs. Kehinde use their own medication. Please, any other questions? Hello?
Hello?
Any question, please?
Hello, ma.
Yes, ma'am, I'm with you, ma'am.
You said when treating malaria, we should avoid grape. Is it because it's acidic?
It is not because it is acidic. You might take lemon or
Okay. One can take
lime.
lemon.
Yes, but
Okay.
grapefruit, it contains a chemical called furanocomycin, myrine, which can block some liver enzymes that helps the liver to break down medications to get into the body system. It is not just only malaria medication, but malaria medication is common. It can the grape can also affect some other type of medications too. It can affect blood pressure medication. It can affect if someone that is taking anxiety or psychiatric medication, or someone that is taking suppressant medication, or even painkiller medication, even antibiotics. So that grapefruit can affect plenty of those things. So it is better to avoid them. You can still take lemon or lime. They don't
Okay,
contain that chemical component, but grape contains it.
Okay, ma.
Or high dose of vitamin C.
Hello, ma.
Ma?
Please, I want to ask a question. The grape you're talking about, they have the foreign grapes and the other grape.
One grape that is like orange.
Then they have the other grape,
like
the citric grape, the local one. Is it the local one you're talking about?
that grape that is like orange.
Oh, okay. Thank you, ma'am.
It's available in the one that has red, that the inside is red, or another one that the inside is white.
Okay, that's the one you're referring to that we shouldn't take.
Yes, it has two types. Yeah. Any other question?
Doctor, this lecture, please, is it recorded?
No, ma.
It is recorded. It is recorded. It is recorded.
Okay,
From your end?
Yes.
Okay. It is not recorded here. That's why I said no. Okay, thank God it is recorded.
Okay, sir. Thank you, sir.
Hallelujah. Thank you, sir. Thank you, sir. Please, any other question, please? Hello, house.
Hello, Dr. Sugar.
No?
Good evening, Dr. Sugar.
Okay. Good evening, ma'am.
Okay. I'm sorry I've been so quiet because I came in a bit late. I didn't know where you started, but I joined where you were talking about the various types of malaria parasites. And my question is going to be, you said, okay, the test to do, you said the best test to do for malaria is the blood test. And there's this wider, what do you call it, rapid diagnostic test that they only use a test kits. And you just drop your blood and you put a solvent and it shows the line when it is double.
Pregnancy.
Yes, they say it's positive. So, and with this, you cannot determine the kind of parasite that you are treating. So, what do you say about it?
With that, you cannot confirm the species of malaria that you have, but you can confirm that yes, this person get malaria.
So, how do you treat somebody?
The person will go for lab work to confirm the species of malaria and how severe it is. Sometimes it can show 1+, 2+, or 3+. So doing lab work is important. So you might have that other strip at home for first test to just be sure if this person have malaria or not. We also have that strip for typhoid too. The one for typhoid. We also need to go and do tests for typhoid to be able to know how severe it is.
It is well. It means that the health system have been doing a lot of things wrong, because primary health, they supply those kits to health centers, and that is what they rely on to treat.
Yes, probably they rely on it because a particular species of malaria is popular in Nigeria. But you might also take a treatment for malaria and you are still not okay. Do you understand? If other medications are not being used, then there will not be, if doing that test is not important, you will not see somebody using chloroquine or quinine. You understand? Or ACT or Artemis, different species, they are in the market for a purpose. You understand? So these things are very, very important. Plasmodium falciparum is the most popular one in Nigeria. So they are just assuming, because that's the most popular one, but they might end up killing somebody's child with that ignorance because they know that there are other species.
All right, thank you, ma'am. I appreciate the explanation.
Yes, ma'am.
Hope you are enjoying yourself.
I'm planning, it's just that I don't have husband yet.
Oh, sorry for you.
Yes, ma'am.
Please, my question goes to the medications of malaria.
Yes, ma'am.
You know, we have 5 types of malaria. And
yes, ma'am.
Their names according to orthodox medications.
Yes, ma'am.
Also, that we have it in our herbal traditional medicine.
Yes, we have it in the herbal traditional medicine. But from this thing that I've explained now, that we have Artemis, we have chloroquine, we have ACT, quinine, we can relate. Abi?
I can relate.
Good. I need to let us understand this aspect first, so that we'll be able to relate better. When I'm teaching the herbal aspects, we will now know that fall under artemisinin, herbs that fall under chloroquine or quinine. You understand? There are herbs that fall under this category too, which we are going to talk about that next week in our next week class.
Okay, because why I ask is where you made mention of if the person is not getting treated before 2 days, if we did not get any positive results, there are 2 things. There are 2 things we will add. That is where I now came up with this question.
When the person is taking medication and the person is not getting better in 2-3 days, then that means there is a problem.
And you said if that person did not do proper test, that there are 2 things we are going to add to the medication the person is taking, so that there will be positive results. So that is why I'm asking.
I didn't get that, man.
You said if the person that is having temperature, In 2 days' time, the person should be under severe monitoring. We should be monitoring the person for 2 days. If there is no positive turnout, that there is this 2 medication we will add, because that is not good that as we are treating somebody, there is no positive response. So
no, I didn't say medication should be added. I'm saying when you are taking malaria medication, when someone is taking malaria, and within 2 to 3 days, and the person is not responding, then you